Go.
Hi guys, it's Dr. Denny over at Four Paws at Fulshire Veterinary Clinic, and today Maddie and I are going to be chatting a little more about some frequently asked questions you may have about heartworm disease.
Dr. Denny, how is my dog tested for heartworm disease?
So the way that we test here at Four Paws at Fulshire is we use a snap test, or we will send out blood to the lab. And what that's testing for is the antigens, or basically particles from the heartworms in the bloodstream, and we're looking, to see if we come up positive or negative. Another way that we can test for heartworm disease that we do in clinic is heartworms will have babies. They have babies, and their babies are called microfilaria, and they float around in the bloodstream, and they're microscopic, and the kind of it's like not cool, but then it is cool if you're kind of a nerd, so it's cool. But on a blood smear, which is where we take a live drop of blood and we don't stain it, we don't dry it, and we put it directly on a microscope and put a cover slip over it. And when you look with the microscope, you can actually see these little worms, these little baby heartworms that are the larvae, the microfilaria, flip around, and you can see them. While I don't want any patient to ever get heartworms, I think it's like when you look under the microscope, you're like, oh, like science, it's cool, right? But that's another way we can diagnose heartworms.
When should my dog be tested for heartworms?
So we do annual, meaning yearly, heartworm tests on all of our patients. That is required for us, like our hospital's policy, to be able to give heartworm prevention. And the reason that's so important is that I don't know about you, but I'm not perfect. 100% not perfect. My name is Dr. Denny, and I am not a perfect human. And what that means is I may not give heartworm prevention on the same day every single month at the same time. There's been a couple times when I may be a day or two late. And thank God my husband, who's an engineer, can pick up the slack on that. But there are times when we are human and life happens, and we might forget to give a dose or be late. And that window, because we can only kill just a couple stages of this massive life cycle that the heartworm has. The heartworm life cycle, it takes 6 months. There's so many stages of the heartworm's life, and we can only kill 2 of those stages. So even being late by a day or 2 could be detrimental to your pet. And we need to know if that's happening, because heartworms, when they're in the heart, number one, any heart doesn't appreciate having worms in it. It causes irreparable heart damage. So it's super vital that we know, which of our patients are heartworm positive, because it changes everything. It's going to change what the owner needs to watch for. We're going to talk about heartworm treatment. We're going to talk about, hey, what are the changes that can happen to the heart? We're going to talk about, if we have heartworms, we got treated, now we're 6 years down the road, we need to be watching for heart disease, because the irreparable heart damage has already been done. So there's so much that goes into this, but that's why it's so important to have a yearly heartworm test. And I know there are people out there, because I've experienced them myself, that think that heartworms are something that's made up by veterinarians. And that is so false. That is so false. I have a jar. There's a jar in my office right now of a heart in formalin that has worms inside of it. The heartworms are real, and we're in Texas, we're in Houston, we have we're a high risk area. We have so many mosquitoes and tons of stray and feral dogs that serve as a reservoir or a place where all these heartworms can continue their life cycle. That heartworms is a big deal here. In fact, my new puppy owners, or people that I'm meeting for the first time, when their dogs aren't on heartworm prevention, they get my heartworm talk, where I tell them, I'm very upfront, I don't care if you may not remember me. You may not remember the name of my clinic. You may not remember your technician. You may not remember what street we are on. But the one thing that I want you to remember is heartworm prevention every single month for the duration of your dog's life. It is that important.
If my dog tests positive, do I need additional tests?
So yes, we do. We want to make sure it's not a false positive, right? If we're going to call a dog heartworm positive, we need to make sure that we are 100% and we know that this dog, yes, has heartworms. So we're going to run a second confirmatory test, and I'm also usually going to check a blood smear under the microscope and see if there's microfilaria. The other things that we're going to talk about is checking for changes in the heart and the lungs, because heart and lungs don't appreciate having worms inside of them. It's not good. They're not welcome. They're invaders, and we need to kick them out. But part of how we assess, how the body is handling it is we take chest x-rays. We're looking for airway inflammation. We're looking for enlargement of the heart because part of the valves might be stopped up with a whole bunch of heartworms. The blood pressure may be all wonky. We're going to be looking for concurrent diseases. So, if we have worms in the heart, then your body's not functioning at optimal capacity. Your heart and lungs are compromised. So you're a higher risk for stroke, for passing away suddenly. There's really important that once we have a diagnosis of heartworm disease, it's for us, this is called our heartworm workup, our heartworm treatment workup, because treatment's not fun either. It involves, a series of 3 injections, and we're basically giving, the dogs this medication that's going to kill the heartworms, but it makes the dogs feel like crap. And the heart and the lungs have a lot of pressure on it. So making sure that we know exactly what stage your dog is in when it has heartworms is going to help us avoid side effects from treatment and making sure that it's as safe and as comfortable as possible. All right, guys, I hope this helped answer some questions. It may have given you some more questions. If it has, please give our office a call and we can go ahead and get you in for an appointment. Thanks.